Hello everyone, this is Sradha, a clinical psychologist and someone who helps ADHD sufferers to lead a healthy life. Today's video is not exactly about the management tips as I do generally give you. Today's video is about the diagnosis of ADHD, or specifically speaking, the diagnosis of adult ADHD. Now, when we talk about adult ADHD, there are few symptoms that appears to be commonly found in adults with ADHD. These symptoms are procrastination, emotional dysregulation, relationship problems, that is basically interpersonal issues, having problems and conflicts with partners as well as family members, friends, having difficulty to sustain jobs and interests, and often along with this comes impulsivity in terms of buying things, in terms of doing and getting involved in risk-taking behaviors like substance use or behavioral addictions like gambling or shopping. Now, when you type and search symptoms of ADHD or symptoms of adult ADHD, these are the symptoms that Google will definitely give you. However, as a clinical psychologist and someone who has been in the mental health field since a very long time right now, I have seen a lot of people get confused, either overdiagnose or underdiagnose issues because they have read something online. The problem with this is these symptoms that I mentioned can be also a part of depression, can also be a part of bipolar, can also be a part of personality problems or obsessive compulsive disorder. Now, these are just symptoms. We need to have a diagnostic clarification in order to give you a diagnosis of adult ADHD. And it's a diagnosis. So it has criteria that you need to fulfill. You might be on the range that is mild, moderate, or severe. However, there needs to be a criteria of symptoms and a consistency of having those symptoms. So my advice to you all who are watching this video and suspecting that you have adult ADHD, do visit a clinical psychologist who is trained enough to help you, who is trained enough to understand adult ADHD, because it's not something that is often looked out for in the medical fraternity. So do take a call seriously to get a formal diagnosis. Self-diagnosis is the start, but it's not the end. And if you want to help and get better, you need to take treatment, and that can come from a certified and registered medical professional like a clinical psychologist. This is it for this video, and I would like to end this video on the note that not to take your health advices from Google. Take your health concerns seriously, and that includes your mental health concerns too.